Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Pane, we have another question for you for the Ask Dr. Pane segment. This person comes from our Facebook audience, and their question is they want perkier breasts and upper pole fullness without getting any bigger. A little more into the question here is they had breast reduction lift 3 years ago, and as a result, they ended up with a 36D, previously 36D, and some keliods that never healed. They've dropped a little bit, and they want to perk things up. So, Dr. Pane, what would you suggest in this situation?
Yeah, well, in this situation, I looked at the pictures, and the person has mostly thin scars. There were a few areas where there was some thickening of the scars. I wouldn't call them full keliods, but I think I know what they're talking about. So they want to be more full without resorting to using an implant. Now, because there's been previous breast surgery here, and I don't know if the person has a smoking history or health history, many surgeons are going to rule this person out, except in our practice, we tend not to rule them out. And we have done a number of people like this, and we know how to do it and get reliable, safe results. Here, I think there's enough breast tissue to reposition it and do an internal mastopexy. That's important to keep in mind that these are not going to give permanent full upper pole fullness, no matter what people will tell you, and they'll tell you a lot of different things. Nothing's going to give you quite the same result as the implant, but with careful positioning of the tissue and some attentive suturing, you can get most of that result that should hopefully last a long enough time where the procedure is felt to be satisfying and worthwhile. And we can also revise those scars at the same time. The only caveats here, if the person's a smoker or has some health issues, we want to get those corrected before we undertake the surgery, because it's a secondary breast procedure, and that can lead to a higher risk of complications, which is why a lot of practices routinely don't even approach these cases. We do, but we do it, with our eyes open. So we want to get an assessment of what's happening and then come up with a plan that is going to get as close as possible to meeting this person's goals with a lasting result. So hope that covers it, and let's see what we can do for them.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page, website, Instagram account, or use hashtag AskDrPane, and your question will be answered live on the air. We appreciate your time, and we'll see you on the next question.